Committee members, we'll call the meeting to order as we will be joining us shortly. Welcome to meeting number 16 of the House of Commons Standing Committee on Human Resources, Skills, Social Development and the Status of Persons with Disability. Today's meeting again is taking place in a hybrid format pursuant to the House Order of November 25th. Members are attending in person and attending using Zoom. Those attending in person must follow the health protocols that are currently in place. To ensure an orderly meeting, I would like to take a few moments for the benefits of the witness and members, or make a few comments. Before speaking, please wait until I recognize you by name. For those participating by video conference, please click on the microphone icon to activate your mic. For those in the room, your microphone will be controlled by the Proceedings and Verification Officer. When you are speaking, your mic should be on. When you are not speaking, your mic should be on mute. Members and witnesses may speak in the official language of their choice, and interpretation services are available for this meeting. For those participating by video conference, you have the choice at the bottom of your screen of either floor, English, or French. For those in the room, you can use an earpiece and select the desired channel. If interpretation is lost, please advise me and we will stop the proceedings until it's corrected. A reminder that all comments should be addressed through the chair. Pursuant to Standing Order 1082 and the motion adopted by the committee on Thursday, February the 3rd, the committee will resume its study of labor shortages, working conditions, and the care economy. I would like to welcome our witnesses for the first grouping to begin our discussions with 5 minutes of opening remarks followed by questions, and I would ask the witnesses to please keep your opening comments within the 5 minutes. If you have additional information, you can always submit it to the committee and it will be on the record. And again, I would ask those participating to speak slowly for the benefit of our translation and interpretation services. From the Atkinson Foundation, Armin Yalnizyan. Yalnizyan? Ah, bon.
Bravo.
Canadian Dental Association, Richard Holden, President. Aaron Burry, Acting Chief Executive Officer. Canadian Mental Health Association, Rebecca Shields, Chief Executive Officer, York and South Simcoe Branch. We will start with the Atkinson Foundation for 5 minutes. Madame Yalnizyan, you have the floor. On mute.
Bam. Chair Morrissey, thank you so much. And honored members of the committee, I appreciate greatly the opportunity to speak to you today to address one of the most pressing public policy issues facing Canadians and the future quality of all of our lives, labor shortages and working conditions in the care economy. I thank Benita Zarrillo for tabling the motion to study the issue. You may not know me. I'm an economist, past president of the Canadian Association for Business Economics and business columnist for the Toronto Star. I'm also the Atkinson Fellow on the Future of Workers, and I am indebted to the support of the Atkinson Foundation, which dedicates itself to advancing economic and social justice principles, just like Joseph Atkinson did, the journalist and the business founder of one of Canada's most popular and historically influential newspapers, the Toronto Star. He knew then, as you know today, that strong businesses are made stronger when their workers and their customers are not scrambling to cover their basic needs. So that requires strong governments dedicated to ensuring that programs like healthcare, childcare, elder care, which support the economy every bit as much as roads and bridges, making sure that those programs are both in good repair and fit for purpose. You know, the care economy is often viewed as a derivative, a nice to have once the economy is functioning. It is not, and the pandemic has made abundantly clear it provides the foundation for all other economic activity. And it happens to be an economic powerhouse in and of its own right, accounting for 12.6% of GDP. Did you know that's bigger than auto and oil and gas? It's actually unparalleled by any sector of the economy other than finance and real estate, and we know how well that goes. Care for those who are too young, too old, and too sick to work is always partly unpaid. It is always a labor of love, but paid care now accounts for 1 in 5 jobs in Canada. And though every job could be a great job in this sector, many jobs are unpaid and precarious. Maybe that's because it's female dominated. 90% or more workers in most occupations within health and education are women, and the workforce is also disproportionately racialized. Viewed as essential, these workers are essentially treated as disposable. Population aging means that this sector of the economy is destined to grow, so how it grows matters. Already we are facing labor shortages in small towns and big cities alike. So how we address the shortages matter because it will shape our economy and our nation. We can make every job a good job, and we would transform all of society in the doing. Or we can muddle through, mostly failing to solve the problems. Right now, there is no more pressing labor market issue than how we prepare the care economy for the decades of population aging that lie ahead, making today's challenges pale in comparison. So in order to maximize our potential and minimize the impending challenges, we need a pan-Canadian strategy so no province loses out. Your earlier questions to other witnesses on other days have presaged what that strategy might entail. Firstly, better wages and working conditions, which is possible because so much of the care economy is publicly funded. Secondly, more timely and targeted training, including learning while earning programs. Thirdly, an alignment of federal skills development policies for our own citizens with federal policies to attract newcomers. And these newcomers are increasingly entering as temporary residents, not immigrants who stay and build communities, not just fill jobs. Fourthly, more rapid credentialing of internationally trained professionals and more paths to permanence for those who enter as temporary foreign workers. On your very first day, you learned that the temporary foreign worker program accounts for only 0.4% of the labor force, but hundreds of thousands of other people enter as temporary residents under different programs and work as well. Better use of technology is obviously another element. We can improve timely access to supports, more telehealth, better use of AI to complement human skills for faster diagnostics and better diagnostics, improved use of e-health records to improve wait times and detect trends more quickly, and finally, better monitoring of the ballooning of temporary agencies and on-demand apps because they tend to produce cost overruns and they tend to increase exploitation through scheduling. So that means modernizing our labor laws to reduce the growing number of people who are misclassified as independent contractors and not able to access any labor protections or rights. We urgently need a national strategy for health, human resources, and urgently need standards for long-term care before the federal government dishes out another dollar. Building on what we have learned through the early learning and childcare bilateral agreements that have been signed over the past year, I do wish you Godspeed on your efforts to help inform and guide our next steps, and I'm happy to take your questions. Thank you again.
Thank you, Madame Yelnizyan. Yelnizyan?
You got it.
Oh, thank you. Now to the Canadian Dental Association, and who is going to speak on your behalf.
Thank you, Mr. Chair. I'm hoping you can hear me okay.
Continue.
Bon après, midi adieu, les membres du comité. I'm speaking from Town on the unceded territory of the Abigwit-Mi'kmaq First Nation. My wife and I have both practiced dentistry and PEI for over 30 years. I've been actively involved in organized dentistry for 2 decades, and I currently represent CDA as president. For 120 years, CDA has represented dentists in every province and territory as the national voice of dentistry. We know that oral health is an essential component of overall health, and dentistry is an integral part of healthcare in Canada. There are more than 25,000 Canadian dentists. And if one includes dental hygienists, dental assistants, and others, the dental sector represents a workforce of roughly 100,000 workers. The COVID-19 pandemic had an immense impact on access to dental care. Offices were shut down for months, and upon reopening, we had to put in place new and extensive infection prevention and control procedures to prevent the spread of infection, including wearing enhanced PPE, renovating offices to better separate treatment areas, and purchasing new air filtration equipment. These precautions were very effective, but have come with a significant price tag. Now the post-pandemic reality has created a further challenge: hiring and retaining dental assistants. Dental assistants are the glue that hold dental offices together. It is a skilled profession, and 8 provinces require licensing or registration. In fact, the ESDC recently classified dental assisting as a skilled profession in the National Occupational Classification. The last time you went to the dentist, the person who placed the rubber dams, took x-rays, and walked you through your treatment plan or aftercare instructions was likely a dental assistant. Crucially, they provide a necessary second set of hands to dentists during most dental procedures, from fillings to extractions to root canals. Even before the pandemic, the number of dental assistants was an obstacle to meeting the oral health needs of Canadians. In 2019, 36% of dental offices had unfilled dental assistant positions. From 2010 to 2020, the ratio of new certified dental assistants to new dentists entering the workforce fell from over 3-to-1 to almost 1-to-1. The pandemic only exacerbated this shortage. Dentists need more formally trained, licensed dental assistants to manage new health and safety guidelines, but attrition rates have worsened. Dental offices, particularly during COVID, can be a stressful work environment, and dental assisting can be physically challenging. Furthermore, 99% of dental assistants in Canada are women, with an average age of 38. Many exit dental assisting for other professions due to, among other factors, workplace concerns such as stress and mental health, the desire for flexible hours, and more recently, the appeal of work from home opportunities. It is our goal to work collaboratively to address these issues that directly impact retention of dental assistants. We are hopeful that the federal government's commitments on childcare will help reduce barriers to full participation of women and men in the workforce going forward. CDA recently partnered with the Canadian Dental Assistants Association to submit a project to the ESDC's Sectoral Workforce Solutions Program. Our project, Building the Professional Dental Assisting Workforce of the Future, seeks to address the many factors impacting the attrition of dental assistants from their profession by providing mental health and wellness training for dental office staff, human resources training for dentists and office managers, increase access to certified dental assisting programs through the development of an online-based curriculum, as well as to develop action plans addressing interprovincial labor mobility and better integration of immigrants into the dental workforce. I'm happy to share further details with you and would appreciate any support you may be able to lend. I encourage this committee and the House of Commons Health Committee, which is also studying healthcare human resources, to consider these workforce concerns when making recommendations to government. Focusing solely on the HR needs and challenges of Canada's public health system could have a deleterious effect on healthcare delivered in private settings, such as dental offices. Increasing recruitment into some professions or mandating wages for others can intensify shortages for the rest. I will conclude by commenting on last week's commitment by the federal government to provide greater access to dental care for low-income families. CDA supports all efforts to improve the oral health of Canadians and to increase access to dental care. We have long recommended federal investment to stabilize and enhance provincial and territorial programs that provide care to those Canadians who lack access to dental care. These programs are chronically underfunded and are almost exclusively financed by provincial and territorial governments. Such an approach would provide better and faster access to care to the people who need it most using existing infrastructure as opposed to a large-scale new federal dental care program administered in Ottawa. This would also minimize disruptions for those who already have access to dental care, whether through existing programs or employer-provided benefits. We look forward to collaborating closely with the federal government going forward on better addressing the oral health needs of Canadians. I want to thank you for this opportunity, and I'm happy, along with Dr. Aaron Burry, our interim CEO at CDA, to answer any questions you may have. Thank you.
Thank you, Dr. Holden. Now for the Canadian Mental Health Association, Madame Shields, you have the floor for 5 minutes.
Hello, I'm the Chief Executive Officer for the Canadian Mental Health Association, serving York Region and South Simcoe. We are across 11 provinces and territories at our divisions, with 75 branches serving over 330 communities across Canada. And we are one of the largest clinical providers in all of Ontario. I don't think it's a shock to anyone if I tell you that the mental health demands of Canadians have increased at alarming rates due to the pandemic. and that a strong, robust community sector is required in order to sustain the mental health of all Canadians in the entire workforce. The pressures that we are facing warrant massive increase in investment and smart increases in investment. Pandemic polling conducted by CMHA Ontario reveal alarming statistics. 57% of Ontarians are lonelier compared to when the pandemic began, and nearly 80% believe that we have a mental health crisis once the pandemic is over. Substance abuse is increasing and wait lists are higher than ever. And as my colleagues had mentioned, it is disproportionately affecting women, particularly women with young children at home, who are under both financial pressures and pressures of childcare. However, with men, we are seeing rising rates of substance abuse, both with alcohol and cannabis. And this is a major concern as services are not readily in place. It is no surprise that we see a demand in services that are at an all-time high and a higher complexity of care requiring longer service times before we can achieve recovery. Approximately 80% of all mental health care is provided by community organizations such as mine. And perhaps this is not fully appreciated, the demands on the community sector when we talk so much about the hospital sector and long-term care. But without a robust community sector, there will be more problems faced because we both focus on prevention, early intervention, and ongoing recovery and treatment. However, we have not received base increases in over 15 years. And we are so inadequately funded. Although we may have grown by new services, existing services haven't increased. We are not competitive with our hospital partners. And we're certainly, with increasing policy to support other industries, we are again falling behind. Our admin costs remain at 10%, which is unable to keep up with leadership and tech capacity. And yet we want a data-driven culture where we can actually get the data and analyze it with the business intelligence required to ensure that we're providing quality outcomes to our community. At CMHA, we know that crisis services have jumped over 60%, and yet our critical care nursing shortage is at an all-time high, just like everybody else. Even before the pandemic, some of our branches were underwater. And although we have seen some increases in programs in certain areas across Canada, certainly others are falling behind. I want to give a local example. Locally, my nurses are paid 66% of the hospital nurses and long-term care nurses. You can imagine, although despite the burnout, we require these nurses in order to maintain good care for our homelessness population, for all vulnerable population, and now increasingly the services that we provide to newcomers and refugees. I want to explain why that is so important. You can imagine with the crisis in Ukraine, yet again, CMHA is asked to step up. We serviced over 292 newcomers and refugees last year with results that kept 89% of people demonstrated improved outcomes in depression, and 85% of people improved outcomes in anxiety, allowing for safer transitions and resettlement. This is huge because we want people to resettle quickly, and it's up to the community sector to respond quickly to these urgent needs of our population. The other issue that faces the health human resource crisis is the demand of other healthcare workers. CMHAs across Canada have developed programs such as the Bounce Back program with specific emphasis on managing stress and burnout. However, we can see even with the pandemic, as this is ongoing in all of our healthcare sector, that the stress and pandemic are continuing, and we're seeing an attrition overall of healthcare resources. Critical investments are needed to deal with this stress and burnout, and programs provide respite and relief for staff so that they too can get their vacations. We've been working overtime, ongoing care, and without any increase in funding to meet these needs. We need to have particular funding to focus on diversity, equity, inclusion. I spoke of a newcomer wellbeing program, but we continue to have to respond to the diverse needs of Canada. In summary, I'd like to thank this committee for listening. I have a lot more to say and will answer a lot more questions, but to be brief, we have not had any base funding increase. The demands are at an all-time high for all of our healthcare partners. We need an integrated healthcare system where community is funded as equally and as effectively as our acute hospitals, or else we're going to continue to exacerbate the problems that exist where people's first encounter with mental health services is in the hospital, where it should be in community or with their primary care provider. Thank you.
Thank you, Ms. Shields. We'll now open the floor for questions, beginning with Madame Gladue for 6 minutes.
Thank you, Chair, and thank you to all of our witnesses. I'm going to start today with Richard Holden. You talked about the shortage of dental assistants, in order to service the needs of the existing burden on the dental care system. So in light of the NDP Liberal plan to make a national dental care program that would add people that aren't covered today, do you have the adequate resources to do that plan? And if not, how are we going to get them?
Yeah, great question. And I think I'll start by saying that we do, depending on how the plan comes out, we do feel like that we're treating 3/4 of the Canadian population now fairly adequately. It's that 25 to 30% that sort of is suffering. So we do feel like dentists and assistants can step up. The population to dentist ratios, the dentist to population ratios are still adequate. There's certainly geographic issues that sometimes can come into play. We do know that dentistry in the 60s, 70s, and the 80s, certainly there was higher demands on dentists and the office staff to perform. So I do think that we would step up, certainly to get access, to get more of those vulnerable populations into dental chairs, I think is something that the dental profession would do what they can to do. So it is a challenge. We do feel like we need to do something about the workforce, but at the same time, I think we could probably do that. And I do have my colleague, Dr. Burry, our CDA interim CEO. Aaron, I don't know if you wanted to add anything to that.
Oh, I think you've outlined it well in that we do have dentists have historically stepped up during this period, and we also would make sure that anybody coming to see us that's in need, we look after them. I think this would also reduce some of the demand on the hospital care system as this moves forward. We move people out of that hospital care system and move them into the place. I know I can speak of that as a dentist. I can often solve something, in half an hour to 45 minutes that an emergency room just can't do anything about.
Mm-hmm. Very good. Thank you. A question for Ms. Shields. So I saw that you have CMHA did a study with UBC that said 41% of people in Canada reported a decline in their mental health since the onset of the pandemic, which is what you said. Now, do we know what the impact of these greater number of mental health problems was on employment? I would expect, people might have missed work, or do we have any quantitative measures about that?
I don't have any quantitative measures to give you that are accurate statistics, but I can give you anecdotal information. We know that the rates of sick leave across the country are going up. Much of sick leave, long-term disability and short-term disability are often related to mental health issues as the leading cause of disability. So the correlation is high as people are really facing burnout. In particular, what we're seeing is a huge burnout in the healthcare human resources sector as well. We're seeing nursing, people are retiring. They call it the great move on, as people cannot keep up the pace that they've been keeping up and yet are being demanded to. So it is a crisis because we do know that the stress and the uncertainty take its toll. And again, it's been disproportionately affecting women, particularly women who with households with young children. Mm-hmm. Those women in particular are 2 times more likely to report depression and 1.5 times more likely to report generalized anxiety. And so that has an impact on them, but it also has an impact on their whole families.
Absolutely. The other thing I wanted to talk about was we've seen the increase in addictions. And certainly it's been my passion since I was the shadow health minister to try to call for long-term recovery so that people can get an exit ramp to get off of addiction. But we already didn't have enough of that. And so, could you give us an idea of what you think the federal government could do to help fill that gap?
Oh, I'm so glad you asked that question. There's a couple of really key things. I really believe that we need a public health awareness campaign around the moderate use of alcohol and cannabis in particular. We have seen, particularly with men, since the pandemic, a 39% rise in risky cannabis use and 28% problematic risky alcohol use. With women, it's 18% and 35% respectively. And this is from the Canadian Centre for Substance Abuse and the Mental Health Commission of Canada. So we're seeing people use more. And of course, as they use more over a longer period of time, it becomes harder and harder to treat. So we need early education and intervention. We absolutely need programs that are easy to access. We need the federal government to fund more detox and more crisis services so that we can get people into care. And I agree with you, for some folks, we need long-term care, long residential programs, but we also need to focus in on withdrawal management and ongoing integrated services. Thank you.
Excellent. Well, I think I'm out of time, but I'm sorry because I still had more questions for the next witness, but I'll leave it there. Thank you.
Thank you, Madame Gladue. You had 10 seconds, but it's gone. Mr. Van Bynen, you have the floor for 6 minutes.
Thank you, Mr. Chair, and I do want to thank all of our witnesses for contributing to our discoveries today, but especially you, Rebecca, for all the great work that you're doing in our community. Now, I only have 3 minutes because I'm sharing my time, so I'll unpack my questions right away, and I'll let you respond to the ones that you would see as a priority. So first of all, we've heard the difficulties we have in funding, but beyond that, and we understand what those implications are, beyond that, can you outline what the challenges are that you are facing in maintaining and attracting staff, particularly during the pandemic? And the second question would be, how does your organization overcome those challenges currently, and what would you recommend be considered as part of the longer-term solution in terms of having staff available?
Thank you for that question. We certainly have had challenges because we have not had base funding increases. And of course, we're very worried about a provincial Bill 124, which limits our ability at this time to provide competitive wages to attract new talent. So of course, we can't always rely on more money and better compensation. So what do we focus in on? We certainly focus in on a talent and culture strategy that really focuses in on being a supportive, fun, and engaged, purpose-driven work environment. That's, I think, why everybody comes into the care community, whether you're a dentist or mental health worker, or you're working in an acute care, long-term care center. We all want to make a difference. However, we also want to feel that we're recognized in importance, and so valuing the profession. Recently, all of the healthcare providers in Ontario Central Region put together a statement of solidarity and support against the attacks that we have been faced because of people who are against masking and other public health measures. It has been terrible, the type of abuse that our sector has faced. So by standing in solidarity and protecting our healthcare workers and being the first in line to stand up for them is part of our strategy. So certainly we would absolutely benefit from more funding to equalize wages and being able to attract talent. But at the same time, I know why my staff do this, because they want to make a difference and they want to know that the services are available for their clients. It is their success that fills their hearts. And so by being able to do that in partnership and having services available is what we really need. Thank you.
Thank you. So could you also just elaborate on the mental health challenges that are facing workers today, including the healthcare workers and the mental health and addiction workers, specifically the team that you manage and organize?
Sure. I think it's broken down into the rising complexity of care. honestly, we are seeing exacerbated symptoms because people who may have been treated earlier have waited longer. So people are presenting with much more complexity, deeper issues around substance abuse and misuse, and larger degrees of homelessness and not being adequately housed. They are fearful of coming in, perhaps because of pandemic issues, and we're trying to reach them virtually, which is not enough. Sometimes virtual services can work for mild to moderate depression and anxiety, but when you're dealing with people with complex care issues, you need to see them in person to be able to assess them fully. So we've had challenges in our staff feeling that there's a moral distress and that they can't meet the needs of all Canadians or the people that they serve. And that's very heartbreaking for people. They come into this profession to make a difference. And when they see the wait list growing and they see the complexity, it can be disheartening. We've also had significant challenges around housing affordability in our homelessness programs. In the region of York, affordable housing doesn't exist. Even the rent supplements and ODSP and other benefits, we still cannot find safe and affordable housing. Again, this is a moral distress, and a strong housing strategy that creates affordable and supportive housing for each and every Canadian is essential for us to take care of the most complex individuals. Our staff are burnt out, but our staff work tirelessly to try to address these issues. Thank you.
Madame Ferretta, for not quite 2 minutes.
Merci, Monsieur le Président. Thank you, Mr. Chair. Thank you. My question will be for you, Mrs. Shields, because we don't have a lot of time. I just have 2 minutes. So we've already spoken about solutions as to how the community setting could be recognized. You talked about recognition as to how the community sector is also supporting the healthcare system, especially with regards to mental health. I would like you to come back on this because you tabled a report on March the 1st, and you spoke to some solutions. So, and with this minute and a half, could you please give a concise answer to this and even table your report? Why not?
Sure, thank you. So the report spoke to a robust community mental health and addiction care sector where we provide early, easy access to Canadians. So we support access, we support navigation and referral that is integrated with our other healthcare partners. So we have to look at this in terms of a robust child mental health sector where we're looking at families and early intervention. Most mental health services commence at the ages of 12 to 17, or most mental illness issues commence at the ages of 12 to 17. So we have to invest a lot more services in youth. And it has been youth who have been overly impacted by the pandemic with their schooling. And so we really feel that there is a need to invest in young people, particularly youth, to work with our school partners, to work in collaboration with all of the services that surround youth. We also have to look at seniors' mental health and deal with loneliness and isolation issues, because those, again, chronic loneliness is one of the major factors that affect overall health costs and well-being for each individual. So I'm happy to share the report that was with this committee post this meeting. I'll send it in for your reference. Thank you.
Merci, Madame Ferretta. Madame Chabot pour 6 minutes.
Mrs. Chabot for 6 minutes. Thank you very much, Mr. Chair. Hello to our witnesses, and thank you so much for participating in today's meeting, and thank you for contributing to our study. My first question would be from Mrs. Yanisian. I know that as a journalist and as an economist in your training, you gave some examples in the care economy, but we know that there's a labor shortage. When you look at the impact on the Canadian economy, this has an impact on many different sectors of activity in the manufacturing sector, in small and medium-sized businesses. So I think that I could also talk about the agricultural sector. So the labor shortage, I even read that in Ontario, through the Chamber of Commerce of Ontario, if you had two factors that would help businesses, it was the issue of the labor shortage and also inflation. So if we're looking at the labor shortage, do you have any observations with regards to the impacts that this has on the Canadian economy and the types of solutions that could be found?
Thank you for the question, Madame Chabot. If I understood the question correctly, you were asking how the economic pressures of labor shortages might coincide with inflationary pressures facing all businesses. And I think the inflationary pressures, I know the transitory phase has been going on a lot longer than anybody would like, but we did have a war in addition to a pandemic that won't go away because we won't treat it seriously. But the inflationary pressures are unlikely to last over the long term, whereas the labor shortage issues are likely to accelerate over the next couple of decades, and we need a strategy to deal with it. By simply saying rising wages is going to do it will actually lead to more inflation if that's our only strategy, and we can absolutely maximize the potential of people that we underutilize in our own economy, Indigenous populations, youth at risk, people who are disabled, recent immigrants, women. Like, we could be using all sorts of people more fully, using their potential more fully. We could be using people who already have training. I was interested to hear what Richard Holden said about the dental technicians, and certainly one of the ways in which we met primary and preventive care needs of children for dental care in the late 1970s and early 80s in Saskatchewan and Manitoba was setting up schools for dental technicians, so that dentists became not the number one way that we provided primary and preventive care, but the backup. And dental technicians did most of the heavy lifting by going to the schools for children under the age of 13, pre-high school kids, to provide initial primary and preventive care. So that's an indication that we are underutilizing the capacity we have right under our nose. As I said in my presentation, I think there's other ways that we can prevent wages as being the primary inflationary thing. And one of the key examples of the last year were the early learning and childcare agreements, which will support better wages in the sector providing the care, but also reduce costs to parents. And I think in an era where 1 in 4 Canadian is going to be a senior and living on lower incomes and fixed incomes and very resistant to seeing any protracted period of inflation.
I would have a short question as well, and I don't have a lot of time. Do you believe that the contribution of temporary foreign workers could be a solution to this labor shortage? There is a context of demographics as well. If we look at what's happening in some provinces in Canada, Quebec is in this group, Ontario as well. And do you think that temporary foreign workers is perhaps not a long-term solution, but could be a solution that we could foresee? Is immigration also part of a solution?
100%. We will not be able to deal with all of our labor shortages just with people born in Canada. But the question of what is the relationship between those who are invited to come here as permanent residents and build their lives, and those who are only invited to come here to do the work and are not permitted to stay, is actually an ethical as well as social and economic issue. So yes, we will probably turn to more temporary foreign workers in the short term because immigration is backed up. But we need more paths to permanence. It can't be that they are good enough to come here to work, but not good enough to stay. That doesn't sit well with me as a Canadian, and I'm sure it doesn't sit well with you as a Québécoise.
That's a very important link that you're making. I don't have a lot of time, Mrs. Shields, but I'm trying to understand. If we speak about mental health, I understand what's happening in Quebec a little bit better, and all the community mental health groups receive funding from the Health and Social Services Department, so it's complementary in Quebec, and this does play an important role. And you know that Quebec and provinces are asking for a funding increase with regards to health from the federal government. Do you agree with these that with this increase of funding that's being requested?
Oh,
Please.
absolutely. We need a huge investment. We need investment in publicly funded community-based counseling and psychology programs that have recently launched across Canada, like the Bounce Back program, need to be available for all Canadians. We need to prioritize more investment in housing and income supports and food security, because you are never going to fix somebody's mental health if they are afraid that they have nowhere to live and nothing to eat. We need to increase funding and strengthen the capacity of core mental health addiction services and supports.
Thank you, Ms. Shields. If you could continue at another question. Your time has gone, or Madame Chabot's time has gone by. Now to Madame Zerillo for 6. Madame Zerillo, you have the floor.
Thank you, Mr. Chair. And all of my time will go to questions to Ms. Yalnizyan. We heard today, definitely in previous testimonies, why this sector of the economy is growing. So my questions to Ms. Yalnizyan are to just pivot to shining a light on why the care economy has not been given the respect it deserves over time, and why filling these labor gaps in the care economy is more important now than ever, and to share why this sector as an economy can lead to a bigger economy and a better life for Canadians. And then hopefully I'll have some other time later, but we'll start with those ones.
Thank you, Madame Zerillo. And again, thank you for setting up this conversation. And I appreciate that you're asking me these questions where I can't answer some of the questions of why we haven't invested in them before. We do know that healthcare is the most publicly supported program. And what the pandemic has shown is now childcare is every bit as critical to the functioning of the economy as education is, except childcare was primarily provided through market provision across the country. So a bunch of it will have collapsed because of pandemic economics. The same things that Richard Holden was mentioning: higher costs, lower revenue, fewer people coming in, more expenses to be able to provide it. That also affects businesses that provide childcare that have much lower margins and are very high touch, very labor intensive. Why don't we invest? Why haven't we invested more in childcare? I mean, I have been asked so many times in the last few months, how are you going to pay for it? And all the evidence in the last 25 years shows that if you buy it, it pays for itself in higher labor force participation rates. And so that's in the short term. In the longer term, depending on the type of program you have, because just spending more won't necessarily give you maximum returns. The maximum returns come when you provide high quality care for kids who were at risk of not being learning ready when they enter school and not learning supported as they go through school. You do that, you provide high quality care for these kids that are at risk. Some of the people that Rebecca Shields was talking about, newcomers, immigrants and refugees, people that have been through trauma. You support people or kids that have got disabilities. You give everybody a fighting chance as they enter school and in their early school years, and you maximize their potential for the rest of their lives. You reduce their reliance on unemployment insurance, you reduce their reliance on healthcare, you reduce their reliance on the policing and incarceration system. It pays dividends to the public purse in so many ways, and it increases their individual incomes and earning potential. You improve their learning potential, you improve their earning potential, and how much they pay into the public purse instead of taking out of the public purse. We should have done this 50 years ago when the Royal Commission on Status of Women asked for it. It took us 50 years. We're here now. It's not enough to simply sign the deal. We have to deliver great care. Then I'm going to turn to long-term care. The pandemic showed that it matters how you deliver long-term care. Private, for-profit care, which is the majority of care across the country, was the coffin for so many people because profit preceded care as the number one principle. Too many people in overcrowded rooms, too many low pay workers that were not permitted to add enough hours for benefits to kick in. So they had to go from one home to another, bringing the disease with them everywhere they went. This is craziness. We need to learn from the pandemic and especially with an aging population, the importance of having services at home, services in long-term care facilities, services in child care centers, and services in hospitals that are there for people when they need them. So they can go about the job of getting, growing prosperity, doing the other things that grow GDP. Too often we think about the care economy as the derivative, as I said. It's the thing that happens after the economy grows. In fact, we need to understand that it is the foundation for an economy growing to its maximum potential. And the reality of population aging is not unique to Canada. It is throughout the global north. There are going to be labor shortages in every country. We are going to be competing with other countries everywhere that are rich to attract newcomers, whether they're temporary or permanent, because there simply aren't enough workers anywhere. And what we are going to discover is what the pandemic already revealed if we are willing to pay attention to it, which is once you give people the chance to go about their work because they're not spending all their time providing unpaid care, you maximize potential. You make people healthier, as Rebecca Shields was saying. The people that both Dr. Burry and Richard Holden were talking about, when you got a healthy mouth, you can get a better job. Right? Cavities are mostly preventable if you get at it early with fluoridation programs and you do regular checkups. I mean, these things are costs we could be saving. Why aren't we investing more? Because if it bleeds, it leads. Whatever is the noisiest is what gets funded. And the preventive approach, the preventive healthcare approach that the pandemic is forcing us to take a look at, that in fact the war with Ukraine is forcing us to look at. What are we doing to prevent these things in the first place? Deeply unsexy. They pay dividends. And we won't have a lot of money to burn as a quarter of the population becomes older, pays less in taxes, and draws more in services. So we better figure out a way of maximizing what we get for our tax dollar, and pretty darn fast.
Thank you, Madame Zarrillo. Your time has gone by. Now to Mr. Leipert for 5 minutes. You have the floor.
Thank you, Chair, and thank you to the guests for being with us today. Ms. Shields, I can attest to one thing that you stated, that alcohol consumption has gone up. I can assure you in the last 2 years I've been drinking more than I've ever drank. But seriously, I wanted to make a couple comments and get your feel on whether or not I'm on the right track or the wrong track. And I'll start by saying that I had the privilege of being health minister in the province of Alberta for 2 years, I guess 2009, 2010. Always felt after having that privilege that healthcare in this country has a real structural problem. We spend all of our effort and all of our money on treating sickness and not nearly enough on preventative care. And always felt that mental health was the sort of poor cousin of the healthcare spending, because it's almost a hidden disease where you can see someone who has a broken leg, you better fix it, or someone has cancer, you need to treat cancer. But mental health is a very silent issue. Now, despite the fact that we've spent all of that money on healthcare and continue to spend tremendous amount of money on healthcare, Dr. Smart of the Canadian Medical Association was one of our witnesses in our last meeting, and she described Canada's healthcare system as being on life support and in a crisis. So would you agree that we need to fix the structural problem of healthcare and not just throw more money at it, which is so often the call of everyone that we talk to about how to fix healthcare?
I really do agree with that statement. I think there are efforts made to better integrate healthcare so that we can provide holistic care, and whether it's digital strategies where we can all share electronic medical records, or just how we fund, as you said, better prevention. So I want to just take 2 seconds to talk about that, because it came out of Alberta from the Alberta Health Authority, the impact of chronic loneliness on overall healthcare costs. Chronic loneliness was shown to be the biggest driver of keeping people in hospital that could have been removed from hospital, or ALC, alternate level of care, but it also showed that it was the most likely reason that a senior would end up in hospital is if they were lonely. It is also a driver of chronic illness, and it is equivalent to smoking 15 cigarettes a day. So dealing with chronic loneliness is a huge issue, which could, like other things, have transformative costs if we could deal with that issue, because it drives anxiety, it drives depression, it drives suicide rates, it drives a whole lot of issues that if we tackled early intervention and mental health promotion and belonging, we'd have a much healthier and well-being in society. Thank you.
The second thing I would like to discuss a little bit is the real challenge that we have. We, as a country, we are fortunate enough that we have to be a leader in humanitarian aid. I think that we don't recognize some of the trauma that many of these new Canadians face. I happen to have the privilege of when we finally got some 200 Yazidi women relocated to Calgary. They ended up being primarily in my riding, and some of the stories were just unbelievable. And it was all around the trauma, which clearly goes back to their mental health status. How do we treat situations like that when it's not necessarily a physical issue, but my God, it must be a difficult job.
So I want to share that CMHA, my branch, started the first of its kind in Canada, funded through the federal government, funded through the Immigrant, Refugee and Citizenship Canada, to embed a holistic, trauma-informed mental health care in settlement agencies, and in specific in our region, something that's called welcome centers, where our team was embedded in the welcome centers to provide care, so they didn't have to get referred out of the settlement services. So we had a nurse practitioner to deal with the health care issues and specialized, culturally competent mental health workers. But we also partnered with trauma specialists so that we could deal both with people who had family issues, settlement issues, physical health issues, because for newcomers and refugees, they may not want to talk about their mental health, but it may present as healthcare issues, but then when we dig deeper, there's underlying health costs. So the answer is you have to have a holistic team that has embedded primary care along with specialized treatment that is culturally competent for newcomers and refugees, that has a trauma-informed approach, and it cannot be siloed. You have to work with the community to embed services together so that it is seamless and integrated and builds the capacity of settlement workers to also recognize and refer appropriately. Thank you.
Thank you.
Thank you, Ms. Shields and Mr. Leipert. Now to Mr. Long for last round. And before we do, I want to advise Madame Chabot and Madame Zarillo that we will have time for a short question from each of you before we conclude this round. Mr. Long.
Thank you, Mr. Chair. Good afternoon to my colleagues. Welcome to MP Moise. Welcome to Huma. Mise. Muse. So there we go. Three tries, we'll get it. Listen, first quick question is to Ms. Yalmazian. I'm impressed with your record collection, and we're just wondering, do you have any April Wine, BTO, or Stampeders in that collection?
Are you kidding? Of course.
Okay, well, I'm glad to hear that. Now, actually, my questions will be for Ms. Shields. And Ms. Shields, thanks for your testimony. Thanks to all the witnesses for your testimony. It's very, very beneficial for us. But Ms. Shields, I want to talk to you more and give you an opportunity to elaborate more on just certainly the crisis we're facing in our healthcare system with respect to mental health. And I'm just going to quickly quote, I read an article this afternoon on CBC, and I'm just going to quote this. Rosemary Butte says she spends her shift saying, sorry, a patient is so sick because the surgery was pushed back. Sorry she left a patient's next of kin on hold. Sorry she is stretched too thin, too proud to offer the care she wants to give. She feels so guilty. So, I mean, we're all aware so many healthcare workers are cracking under the strain of the system. And, you know, us as a society, the community, you know, we're trying to move past the pandemic. But we have a healthcare force, a caregiving force that is exhausted and depleted. And, you know, we've heard, Ms. Shields, from multiple witnesses that healthcare workers are depleted and distressed. We are told that rates of severe burnout among healthcare workers have almost doubled. And recent figures show that 20% of frontline healthcare workers have thought about suicide, and sadly, 6% had planned an attempt. So, Ms. Shields, can you speak and elaborate more and in more detail what your organization has heard from healthcare workers? Thank you.
I think I've heard the same thing that you've heard. In fact, we witness it. We partner, we work inside our hospitals. So our staff working in an integrated manner. And so it is both the moral distress of not being able to provide the care, the burnout, the pandemic, just having to deal with the number of deaths that have happened that you've witnessed, transferring patients, holding, you know, one of the nurses I know said I had to hold my nose because I had to transfer patient to another hospital far away from their family. And that was the only thing we could do, even though I knew it wasn't best for them or their family. But there was just no space. And the reality is that our ICUs are still filling up with people with COVID. COVID isn't over for the healthcare system. It isn't over for long-term care. And I mentioned the impact of healthcare workers feeling that they were being threatened and protested against by people who were protesting against public health guidelines. You know, that wasn't the ringing of the pots and pans anymore. It was them feeling that they were told that they couldn't wear their nursing uniforms or their medical uniforms to care. So we need to stand in solidarity with our healthcare workers. We need to remind Canadians that they deserve the compassion and empathy that you want them to have, because I know, and I think all Canadians know, that when you show up to the Emerge for yourself or your loved one or your child, you want your doctor or nurse to be at the best of their game. And when they're burnt out and tired, they may not be, and that puts everybody at risk.
Thank you for that. And Ms. Shields, I just want to continue on. Our Minister of Health, Mental Health and Addictions, and Associate Minister of Health, Minister Bennett, has been tasked in her mandate to strengthen our mental health systems. Last week, our government introduced a $2 billion transfer to provinces and territories that would assist in improving mental health services. By treating our mental health as we do our physical health, do you think this will encourage people to enter the healthcare field? And how can it help with labor shortages we are currently facing?
I think the fact that there's an investment and people can see careers in mental health where they can support the well-being of their community and the integration of health and mental health. Mental health is health, and we know that. So as we integrate care, I think it's going to be an exciting profession where people can really make change and improve well-being. And that's why we do this. This is why I'm in my role, because I want to make a difference. So I applaud the investment. But I do make a recommendation. One of the investments that they spoke about, or one of the directions, was to support more funding for colleges and universities to fund counseling and services for youth. But I really worry that they're going to fund the colleges and universities to provide that care rather than community or healthcare providers, creating yet another silo where you have healthcare funded through universities, healthcare funded through provinces. So what I urge is that all the services are integrated. And again, it's just the way that I talked about that refugee and settlement program, that it is integrated so that those people can have holistic care and not just siloed, and we create more navigation problems.
Thank you very much.
Ms. Shields, Mr. Long, Madame Chabot.
Thank you. My question is for Mr. Holden from the Canadian Dental Association. It has to do with dental hygienists or dental assistants. I believe that I've understood the issue, which is that for dental assistants, there was a labor shortage, a lack of dental assistants. I know the situation in Quebec. With regards to training in Quebec, this is a post-secondary training, so no one can just call themselves a dental assistant. It's a qualified training. It's a professional training program. So as for the labor shortage, could you speak to what's happening in different provinces, or is it regional? Is it throughout Canada? Is this labor shortage throughout the country, or are certain provinces harder hit?
Yeah, thanks for the question. It is regional. It's provincial and territorial. That's the way it's. We estimate that. And just to be clear, dental assisting is different than dental hygienist. Dental hygienist, it's usually post-secondary or at it is university college, but dental assisting is usually less time spent in school than the dental hygienist. We estimate that there's probably 26 to 29,000 dental assistants in Canada, but they're unregulated in Ontario and Quebec. There's about 20,000 certified licensed, and hygienists are about 30,000. And there's probably a bit of a manpower challenge with both, but certainly dental assisting is critical because I know firsthand that some dentists just can't adequately work without a dental assistant next to them. So, Dr. Burry, I don't know if you want to elaborate on any of that.
Short answer, Dr. Burry.
Oui, je crois que vous avez souligné plusieurs problèmes.
I think that you've raised several issues. That is, that there is a change with regards to the differences in the provinces in Canada. Another element is a change in the working habits of dental hygienists. A lot of people left the profession because of the pandemic. We had to take the decision of reducing hours. A lot of people left, and as Dr. Holden was saying earlier, this requires professional training, 2 to 4 years, depending on the province. There is less pressure right now, but yes, this is another aspect in the support staff required for dental offices throughout Canada.
See Madame Chabot. Madame Zerillo, one question, please, as we're getting to the end of our first group.
Thank you, Mr. Chair. And my question again is for Ms. Yalnizan. It's around the comments that were made around temporary agencies and on-demand apps. You mentioned the misclassification of workers and the risks of these agencies and on-demand apps. Could you elaborate on that a little bit, please?
I believe it was your
And
second
a short
hearing.
answer, please.
I believe it was your second hearing where you heard from Linda Silas of the Canadian Federation of Nurses Unions, who was the first person in the testimony that I've read from your hearings that mentioned how nurses are burned out and leaving the hospital sector because they have no control over their working hours. They are joining temporary agencies. And in places like rural Ontario, there is no access to home care. The local integrated health networks are unable to provide access to home care. Basically, as soon as you get over 100 kilometers away from a hospital, you don't get access to home care. I mean, you're on a list, you're on a publicly funded list, but you don't get access to home care. So businesses are entering this arena with on-demand apps for home care and filling a need. There's about 12,000 people registered with one on-demand app. Now, these are precisely the workforce allocation techniques that are moving people away from being considered employees covered by
Thank you.
protections.
Thank you, Ms. Yeltsin. I have
We'll
to.
talk.
Okay. Sorry, we are.
Mr. Chair, can I just ask? Sorry, Mr. Chair, can I just ask that the end of that answer just come in paper format?
Yes, that would
later. Thank you.
Yes, that would be very good, Madame Zerillo. Madame Yalnizan, can you provide that to the committee in follow-up in writing? That would be most appreciated. Thank you to all the witnesses for this first grouping for appearing in your testimony before the committee. It is most appreciated. Thank you. We will suspend for a few minutes and change to the second group. Well, merci beaucoup.
Thank you.
Thank you. Merci.
Committee members, we will resume with the second grouping of witnesses. Could we have order in the committee room? Mr. Long, we're resuming. I would like to welcome the witnesses for the second grouping of today's committee hearing, and I would ask you to keep your opening statements to 5 minutes or less, as we are time constrained. With the Canadian Home Builders Association, Kevin Lee, Chief Executive Officer; Mike Collins-Williams, Member and Chief Executive Officer, West End Home Builders Association; from the Conseil de la Transformation Ultimatière du Québec, Dimitri Freyes, Vice President; Isabelle LeBlanc, Corporate Director; Food and Beverage Canada, Kathleen Sullivan, Chief Executive Officer. We will begin with the Canadian Home Builders Association for 5 minutes. Gentlemen, whichever one is starting.
Thank you, Mr. Chair. It's Kevin Lee here, CEO of the Canadian Home Builders Association. CHBA is the voice of Canada's residential construction industry, and we represent some 9,000 member firms from coast to coast, including home builders, renovators, trade contractors, product and material manufacturers, and building suppliers and services. And CHBA is one association working at 3 levels, nationally, provincially, and locally. We have over 50 constituent associations at the local and provincial level. And I'm joined here today by my colleague, Mike Collins-Williams, the CEO of the West End Home Builders Association, our constituent association in the Hamilton-Halton region. And Mike will be bringing some local context to both our opening remarks and questions the committee may have. As you may know, our industry is experiencing chronic labor shortages like so many others, something we faced prior to the pandemic. These labor shortages are causing delays in construction of much needed supply, with 71% of our membership facing those delays according to our housing market index. Approximately 20% of our labor force is set to retire over the next decade, which means the sector will need to recruit more than 148,000 new workers to keep pace with retirements and demand. However, only about 107,000 of those new workers are expected to be available from traditional shortages, leaving a shortfall of about 30%. A large portion of new recruitment will therefore need to come from groups traditionally underrepresented in the construction labor force, including women, Indigenous people, and new Canadians. I should note that the data for this comes from BuildForce Canada, a national industry-led organization that represents all sectors in construction to support labor market development in the industry. Unfortunately, funding for BuildForce normally received to develop its LMI under the Sectorial Initiatives Program at ESDC was denied this year, as it was for many LMI organizations in different sectors, and BuildForce is now having to reapply under a new initiative where, again, its funding is uncertain. So I'd just like to point out that a time when home construction industry is facing serious labor challenges, as are many others, it's important that we get these LMI funding mechanisms back in place. Regarding actions to address skilled shortages themselves, CHBA asks that the government continue all actions to promote careers in skilled trades, to support training, and to provide financial supports to companies and individuals with respect to skilled workers. A good example is the new Canadian Apprenticeship Service. And our association is continually working to address the skilled trades gap, and government supports of this nature are very beneficial. Given the shortfall that we expect in labor from domestic pools, CHBA is asking the government to improve the immigration system for skilled workers through permanent immigration options. This can be done by enhancing the selection of immigrants with skilled trades credentials or construction experience to ensure that the residential construction sector will receive its proportionate share of newcomers. It's also critical that skilled labor allocations for immigration be increased and that pathways from temporary workers to permanent workers be streamlined. CHBA is also working on a new initiative to increase our renovation industry's capacity to adapt homes for aging in place, a key support to seniors and to the healthcare system, and I'd be happy to expand on that if that is of interest to the committee. But now I'd like to pass it on to my colleague Mike to say a few words.
Thank you, Kevin. The issues Kevin spoke about at the national level are very much at play in the Hamilton region and across the west end of the Golden Horseshoe. Ontario's residential construction industry is expected to rise by 4% over the coming decade, and potentially much more if we are to make up ground catching up on our housing supply shortfall, an issue now thankfully well recognized in Ontario and across the country. To achieve the necessary growth in housing starts, Ontario must remain focused on replenishing our residential construction labor force, an astounding 22% of which is expected to retire over the coming decade. As the last of the baby boomers are expected to be 65 years old by 2029. Ontario's residential construction sector is expected to see almost 52,400 workers exit the industry to retirement. Due to an aging population and increased competition for talented youth amongst the province's industries, attracting new workers for careers in construction is going to be challenging. Based on historical trends, Ontario is expected to bring in 42,732 new entrants from the local population aged 30 and younger, a pace that's expected to lag departures due to retirement each and every year over the scenario period. Should recruitment success not increase, the province could be looking at a recruitment gap of almost 17,700 workers by 2030. And we are already seeing the impacts of these labor shortages. The CHBA Housing Market Index Kevin referenced in his remarks is showing construction delays in Ontario of 11 weeks due to labor and supply chain issues. I won't repeat the recommendations Kevin provided, but suffice to say, we have those same recommendations certainly would apply in the Hamilton area. Thank you very much, and we look forward to answering any questions you may have.
Thank you. Now to the conseil pour 5 minutes. Monsieur Freyes.
Mr. Freyes? Yes. Hello, thank you. My name is Dimitri Freyes. I am Vice President of Innovation and Economic Affairs at CETAC, Conseil de la Transformation Alimentaire. I'm accompanied by Isabelle Leblond, Corporate Director at Olimel. The Conseil CETAC is the main business association in the food and beverage processing sector in Quebec. The CETAC is a federation of 14 sectoral associations. In Quebec and Canada, the food and beverage processing industry is the largest manufacturing employer, with 75,000 jobs in Quebec and 300,000 in Canada. Our industry is facing a labor shortage crisis. The number of vacant positions is rising, varying between 20 and 40% depending on the plant. Food and beverage manufacturing was already experiencing workforce issues prior to COVID-19, but the pressure of the pandemic has worsened the situation, and the sector now needs an urgent solution. Despite aggressive recruitment initiatives to fill vacancies, it's been impossible to find enough Canadians to fill food and beverage manufacturing jobs. Recruiting staff is extremely difficult. While other sectors are also facing labor challenges, we are now all competing for the same workers who are increasingly scarce. The inability to maintain a stable workforce impacts food security, economic recovery, animal welfare, and undermines the sector's ability to sustain a national food and agricultural system. Without enough workers, companies are dropping product lines, halting production, adding overtime, exhausting a workforce already under additional strain from the pandemic, or postponing expansion plans. It's not uncommon for family members to participate in plant activities to keep production going. While food and beverage processing is just one of many sectors experiencing labor shortages, failure to meet current labor needs will impact national food security and affordability, and will impact the ability of Canadians to easily access the food that they want. An increase in the cost of food will be an additional challenge due to the inflation that has already increased the cost of living. At this time of declining global food supply, it is imperative that Canada increase food production and processing so that we can share our food with countries that are not so fortunate. The Temporary Foreign Worker Program helps fill this gap. This program is a lifeline for companies that are stretched to the limit. This program needs to become permanent, as demographic curves indicate that the labor shortage situation will last at least until 2030. Our concern is the time frame. It takes 8 to 10 months from the filing of the Labor Market Impact Assessment, LMIA, to the arrival of the foreign workers. The delays are 4 to 5 months for the analysis of the LMIAs and 3 to 6 months for obtaining visas. In Quebec, it's even longer, up to 1 year, since companies must recruit before filing the LMIA. Agricultural companies are exempt from visas. Their workers come from Mexico or Guatemala. On the other hand, processing companies recruit from French-speaking regions in Quebec, for example, North Africa and Madagascar, that do not have this exemption. This lengthens the delays. We're proposing a few solutions. First, be able to issue 1 LMIA per plant, allowing a large number of temporary foreign worker requests to be combined on the same document. Fewer LMIAs will speed up the analysis process. 2, to allow Quebec companies to benefit from the study time of these LMIAs to finalize the recruitment. This is specific to Quebec. Agree on agreements with French-speaking countries to obtain fast-track visas, same as we have for Mexico and Guatemala. Create a trusted employer category for companies that have been filing LMIAs for more than 5 years and renew each year. So a type of nexus or a fast-track system. This way, companies won't have to wait for the LMIA analysis process. Finally, increase the maximum number of temporary foreign workers per company to 30%, including Quebec, which has a special agreement with the Government of Canada to raise the cap to 20%. Thank you for the opportunity to speak, and we look forward to your questions. Thank you. Mr. Freyes.
To Madame Sullivan for 5 minutes.
Good afternoon. My name is Kathleen Sullivan, and I am CEO of Food and Beverage Canada. Food and Beverage Canada is the national association representing Canada's domestic food and beverage manufacturing sector. I appreciate the opportunity to meet with you to discuss labor shortages in our industry. Canada's food system is the foundation of this country's national food sovereignty. It contributes to Canada's national, provincial, and regional economies. It supports our international trade goals, and it underpins local food production and food security. Food and beverage manufacturing is at the center of that food system. Part of Canada's critical infrastructure, my members operate almost 8,000 plants, generate $118 billion in annual sales, and at peak capacity employ almost 300,000 workers. We are, in fact, the largest manufacturing employer in the country. But today, we are facing a destabilizing labor crisis. On average today, food plants are reporting structural vacancy rates of over 20%, sometimes as high as 30% or more. These shortages have resulted in reduced food production, heightened animal welfare concerns, and significant emotional and physical pressure or burnout on our existing workforce. These labor shortages are now structural. They will continue even after the pandemic. And worse still, we are expecting the situation to deteriorate as companies anticipate significant retirements over the next 5 years. We recognize and welcome recent commitments from federal and provincial governments to help address labor issues. And that, of course, includes the $85 million in additional resources to assist in processing times at the departments of ESDC and IRCC. But the truth is these initiatives will take some time to roll out, and they won't provide the relief that we need in the immediate term. We were very pleased to see that Minister Bibeau and Minister Qualtroux's mandate letters acknowledged the serious labor challenges in agri-food and asked them to develop a labor strategy to address persistent and chronic shortages in the agriculture and food processing sectors. In fact, as industry, we have already stepped forward to play a leadership role in developing that strategy. The Canadian Agricultural Human Resources Council, Canadian Federation of Agriculture, and my organization have launched a project to develop a workforce strategic plan for agriculture and food and beverage manufacturing to address chronic labor issues in our sector. But as food and beverage manufacturing focuses on the future, we also need relief today. And so since last fall, my organization has been leading a coalition of 11 industry associations that have developed a proposal for an emergency foreign worker program to support industry through this immediate crisis. That proposal builds on existing programs within ESDC and IRCC and would allow for additional foreign workers to come to Canada over the next 18 to 24 months to support our sector while also offering them real pathways to permanent residency. In closing, I would like to acknowledge the dedication of everyone in Canada's food system over the past 2 years as they've worked to keep the food supply chain operating. Working together, they have continued to ensure that Canadians have access to Canadian food. It is imperative that we now provide them with the support to ensure that that work can continue. I look forward to answering any of your questions. Thank you.
Thank you, Madame Sullivan. We'll now open the floor for questions, beginning with Madame Kusi for 6 minutes.
Merci beaucoup, Monsieur le Président.
Thank you, Mr. Chair, and thank you for the witnesses. Thank you for being with us today.
Ms. Sullivan, as you mentioned, the Food and Beverage Canada, along with other associations, recently produced a proposal to government called the Emergency Foreign Worker Program. Could you please table that proposal with the committee?
Of course, I'd be happy to forward that to you. I will just identify that the proposal has 3 main elements. The first is to it really builds on the existing temporary foreign worker program. The first is to increase the cap or the limit on the number of foreign workers that Canadian businesses can use. The second is to extend the length of the validity of labor market impact assessments, or LMIAs. They currently last for only 1 year, and even if you're bringing the same worker in the next year, you have to go through all of the paperwork again. So we're asking that these be given a longer duration of 2 years or more. And then finally, we're asking that ESDC reduce the amount of paperwork that is necessary, or administrative steps that companies have to go through when they apply to bring temporary foreign workers into the country. It is an easing on the administrative side, and I want to be very clear that it does that without lessening in any way the protections and the benefits that we need to be providing to the foreign workers when they're here in the country.
Thank you. Why did you and these other organizations come together to develop the Emergency Foreign Worker Program proposal? And do these organizations believe the government is doing enough at the moment to mitigate labor shortages in the farming and food processing industries?
Well, we came and worked together, and I will just point out that CTAC, and Dimitri is here, is a member of my organization and also part of our 11 organization coalition. We came together because this is the single most debilitating issue that's impacting food and beverage manufacturing today. We didn't have a choice. We really had to come up with some short-term measures to really alleviate the pressure that our companies are facing, but most importantly, our workers are facing. These people have continued to go to work for 2 years in congregate settings to make sure that the rest of us, really have food on our tables. We, as you know, have been working very hard for the past 3 months. I am pleased to report that this past Monday, we had a meeting with Minister Qualtrough from ESDC. She did confirm for us that she has reviewed our proposal in depth and is looking at it. And we left that meeting, I will say, feeling that in terms of that specific proposal, we do have the attention of the federal government.
Excellent. How would you say these labor shortages impact the supply and cost of groceries for Canadians?
Well, Public Safety Canada did a survey in January that found that because of labor, companies reported their food production had gone down by 20%. So, we're in a situation where, hard to believe, a country like Canada actually can't keep up with our own food production. It's dazzling. And we know we're not the only industry facing labor problems. So I think the impact in terms of food supply is quite significant. Also, animal welfare, and Dimitri pointed this out as well. A lot of the products that we manufacture involve receiving animals. And if we don't have people to receive animals in the processing plants, you really cause a backup at the farm and cause a lot of problems for producers, and also concerns in terms of the welfare and managing those animals on farm beyond where they should have been. In terms of food inflation, we are clearly seeing significant food inflation in Canada. The rate reported at the end of February was 7.4%. I think that's the highest we've seen since the 1990s. So clearly Canadians are paying a price for all of the effects that we're seeing in the food industry in terms of labor and also supply chain issues. And I should say that's expected to go up again this year.
Indeed. Thank you. Mr. Lee, the construction industry continues to face chronic labor and skills shortages. How, in your opinion, has this impacted the supply of houses in Canada?
We're definitely seeing construction delays. As Mike mentioned, our housing market index is showing a delay of 10 weeks on average across the country. Remarkably, this past year, we did have a very strong year in terms of housing starts, getting 271,000 starts across the country underway. The big challenge is going to be, can we close all of those? Can we complete all of those? And with over 70% of our members seeing those labor challenges, there are definitely delays. And I think the longer this goes on in terms of the shortage, the bigger and bigger a challenge it's going to be. We are optimistic, though, that with new measures the government will hopefully be putting in place, we can get access to more land and start accelerating the development approval process so we can keep building. But it's definitely a big challenge.
And how have these labor shortages in other areas of the supply chain besides construction, impacted building homes across the country?
Well, in addition to the delays, because the delays are because of both labor, but also pretty much every product you can think of that goes into construction is being held up in some way, shape, or form. But on top of that, what we've really seen across the industry, like many other sectors, is rapid price inflation on a lot of different products and materials, combination of labor and everything else. So, you know, we're seeing on an average about 2,500 square foot home in Canada, price increases for lumber all by itself of about $34,000 and over $34,000 for everything else from plumbing fixtures to drywall to, as I said, you name it. So we're over $68,000 on average just in construction costs right now as a result of the scrambled up supply chain.
Thank you, Madame Kusi and Mr. Lee and Mr. Collins for 6 minutes.
Thanks, Mr. Chairman, and welcome to all the witnesses. Always nice to see someone as well from the Hamilton area. So my first question will be to Mr. Collins-Williams. As he knows, our government has prioritized both affordable housing and housing affordability as priorities. And there's lots of discussion about the lack of housing supply and its effect on the cost of housing. How much of a role does labor supply and skilled trades factor into escalating house prices?
I'd say that it's a significant factor. Housing prices and what goes into the cost of home is complicated. Essentially there's the land component, the materials component, and the labor component. We're having a lot of challenges in Hamilton, across Ontario, and I'm sure Mr. Lee could attest to right across the country, filling positions. I think you'd be shocked, actually, if you walked around the average construction site in Hamilton as to what the average age is. You have people doing some pretty difficult jobs that aren't exactly spring chickens. We need to attract more people into the industry, and part of that's on the industry to promote careers in construction. And we certainly work with our local community colleges, high schools, trying to get more young people to choose that career path, because it can be a very rewarding career path. But I think one of the challenges we have, and we're looking to the federal government for help with, is the economic immigration stream to bring in more skilled workers to help us fill those job positions. Anecdotally, I hear from our members that the labor situation is so tough that you actually have different home builders almost poaching laborers from each other off of sites. And this is a challenge across Southern Ontario that we do have a housing supply challenge in terms of population growth. And we are building a lot of homes, but that certainly requires labor, and in particular, skilled labor. A home is a complicated system. It is not general labor. A lot of it is skilled labor, and in particular, different trades like electricians, plumbers, carpenters, roofers, et cetera. There are tremendous opportunities in the sector.
Thank you, Mr. Collins-Williams. Next question is around just what you referenced there, and that's the labor shortages and the connection to immigration. And I think you mentioned in your opening a 17,000 worker shortfall in the industry. And as you know, our government has prioritized immigration as one of its top priorities. And in 2022, we're expected to see 431,000 new Canadians, which is, I think, a record number. And so we're anxious to obviously see those people who are finding their way to Canada gainfully employed once they arrive. And so how is your industry attracting new immigrants to the industry? And is there anything we can do with our policies related to the temporary foreign worker legislation to assist you in filling those vacant positions, whether they're the 17,000 that you referenced or the larger number that Mr. Lee referenced in his opening?
I think there's a couple threads there. I think it's incredible that Canada is a destination for the best and the brightest from around the world, choosing to come here, choosing to become educated here, to live and raise their family here. but we also need to provide the supply of housing so that those people can be homed and achieve that great Canadian dream of home ownership and be able to settle into their community and thrive. In terms of the employment opportunities, there's tremendous employment opportunities in the industry. If you look at previous waves of immigration, much of Southern Ontario in particular was built by Italian immigrants, Portuguese immigrants, Polish immigrants and a lot of Eastern European immigrants in previous decades. But there was a shift in terms of where our immigration is coming from, and some of the countries in which people are coming to Canada from. There's not as much of a propensity to enter into the construction sector. So I think it's important that the federal government focus on attracting skilled workers that already do have those certificates, whether it's, again, plumbing, electricians, some of those skilled trades that we so desperately need. We spent a lot of time in the past pushing the knowledge-based economy, which is fantastic, but Canadians are very well educated. And I think we need to try to focus a bit more on bringing people into Canada who can do the jobs that we so desperately are having trouble filling or having trouble getting young Canadians to pursue. And I would add that these jobs are highly skilled. This is not general labor. So the economic immigrants, they bring talent, they bring innovation and financial investments to Canada. So we'd certainly like a focus on the federal skilled workers program. Let's enhance and focus on skilled workers, and because we need them in Hamilton, we need them in Ontario, and we need them across Canada.
Thank you for those answers. I think I'm out of time at this point, Mr. Chairman.
Thank you, Mr. Collins. That will give Madame Chabot a bit more time.
Madame Chabot, thank you. Thank you. Hello, and thank you to all the witnesses. Thank you for being here, and thank you for your contribution and your testimony. If I had to make an observation, you all represent the residential sector, the need to house oneself, the food sector, we need to feed ourselves, and these are fundamental needs of citizens. And I think that your testimony is very important, and we do have to support you. My question will be for Mr. Freyes. In the food processing sector in Quebec, for the federal government, we see that the food sector has been considered as an essential sector in Canada, and in this sense you did illustrate the issues that you're experiencing with regards to the LMIAs. Yes, it's very, very difficult for many businesses, and as MPs it's hard for us to work on this. I know that you sent to the minister an emergency program before the holidays to try to remedy these issues linked to temporary foreign workers. Now we are here in April. Have you received any clear answers with regards to the emergency foreign worker program, suggested solutions? And if not, why not? Thank you. Yes. We are quite supported by the Minister of Agriculture and Mrs. Qualtrough. A meeting was held last week with Mrs. Qualtrough, and she showed a lot of openness and she really listened. I have to say that things have not really changed immediately. Our main concern is the time that it takes. Tomorrow is April the 1st, and people will start to sow, and then we will need to harvest and process the food. So there's a 3-month delay here, and it's urgent. It's urgent that workers arrive in the upcoming weeks. And we are very concerned because right now, with the delays, we're wondering how it's even going to be possible. Last year, we had a case where the cucumber processing plants. Specifically, the harvest is in August and the workers arrived in September. Okay, so that's not very useful. It's a waste of time for the civil servants who worked to have them come here. So what we've suggested is to try to simplify the processes so that they are quicker. And as Mrs. Sullivan suggested earlier, this emergency foreign worker program, what we're asking for is a fast-track system to avoid these delays. We're talking about perhaps grouping together LMIAs to allow Quebec. We also have this constraint of trying to find Francophone workers and to reduce the delays to a few weeks. Before the pandemic, this was possible. It was possible in 3 months, and we would like for this to come back to a reasonable timeline. So this is what we hope for over the short term. Yes, could you clearly illustrate? You are clear, but I'd like to talk about the consequences of these delays, the concrete consequences that this has on the ground. Sometimes we hear tell that there are businesses that totally give up, or they might decide to not even do a harvest or to abandon something because they don't have the support of temporary foreign workers. And in this context of a worker shortage, I believe that the worker shortage has worsened. So I would like for you to tell us what are concrete consequences and what is stopping a fast track program. Well, some products are no longer processed because there are workers that are required. I was trying to explain what happened. I could try to happen what happens in slaughterhouses, but in some processing plants, the products are delivered late or they're not processed correctly. As I was saying earlier, the supply delays are also very long, and so the plants oftentimes have to review the schedule, the production schedule. So less workers makes it so that you might have office workers who all of a sudden have to contribute in the plant in order to be able to process the food. Sometimes there are family members. Oftentimes, these are family plants, and so you have the uncles and the sisters and the mothers that come to the plant to try to lend a hand. So oftentimes, the owner is there from 8 to 5 and is doing work, and so these are very long hours. The employees are tired. Here's an example. Last year, in a vegetable processing plant, there were some workers who worked nonstop for 12 days in a row, and the employer then had to give them a weekend off. If they had had temporary foreign workers, it would have allowed them to be able to rest. By having foreign workers, it allows more stability, more health and safety on the job. It allows us to feed the population adequately, and it also allows to stock up for the winter to come. Thank you, Mrs. Chabot and Mr. Freyes.
For 6 minutes, Madame Zerillo.
Thank you so much. And thank you to all the witnesses that have come in and shared today. I guess I heard retirements quite a bit in the testimony, and I just wanted to ask some questions, and maybe each of the witnesses could talk about their industry and retirements, and if there was planning, 5 years, a decade before, if there was planning around retirements, why local workers are not backfilling, why some of these jobs are not getting backfilled by local workers. And also, how did we get to this point where we're relying so heavily on foreign workers?
I guess I can jump in if you like to start from the residential sector.
Thank you.
This is not a surprise for us. This is not new for us. This is something that has been of concern for quite some time and something we've been talking about. We don't rely heavily as a sector on foreign workers as much as we do on immigration. For example, we're not big users of the temporary foreign worker program because we need people all year round, sort of permanently. So certainly those the recommendations that we would have around things like temporary foreign workers are that idea of facilitating pathways, as you're hearing from other witnesses, to more permanent residency. And I don't think one thing we haven't heard yet in this session is the importance of a trusted employers program, which would dramatically help those who are having to use these types of systems repeatedly. But in terms of the retirements, I think every sector is facing it because it's pure demographics in Canada. And, I know you heard earlier about the aging society that we in many developed countries have. And so it's something we've been looking towards. Everybody's looking to see what underrepresented groups, can be more fully engaged in employment. And therefore also too, though, we need immigration. And I think you're seeing in almost every sector a look to productivity as well, because as we've heard, we're all competing for a very limited labor supply within Canada just because of the demographics. So I think we're all active in recruiting, trying to make our industries even more attractive to come and work. Fortunately, in residential construction, we also have good paying jobs as well, but it's a challenge. It's not new. It's not something that we're new talking about, but it's a big challenge for us and many other sectors.
If I could step in and maybe answer for food and beverage manufacturing. On the retirement question, you're correct. We always anticipated a retirement cliff. And really going into even before COVID started, we were starting to look at these issues and try to understand how do we make sure we've got the workforce of the future. What happened with COVID, though, is it seems that the retirement cliff advanced by a number of years. So when we were going into COVID, we were facing about a 10% structural vacancy rate. In the last 2 years alone, that has increased to 20%. And so we have seen an exodus in our case out of our sector and in many cases out of the workforce itself. With respect to local workers, this certainly has been a challenge that a lot of industries are facing. It does appear in some respects that we are at almost full employment levels. What we really have to be doing at this point in time is understanding how do we expand the Canadian workforce. And that's a number of different things. One is taking a look at people or groups of people who are just not ready for the workplace right now, and how do we remove the barriers that they're facing and really empower them to be able to join the workforce, whether it's for my sector or for its other sectors. And I think in the past we've spent some time talking about how we need to do that. I think, I guess crisis is a great motivator, and what's becoming clear to everybody is that we have to get very serious about how do we identify groups of Canadians who are not participating in the workforce, and how do we help them get to that point. In terms of foreign workers, we are not a huge relier on foreign. We're less than 10% of our workers would be TFWs. But the challenge we really face as a sector is most of our workers don't qualify for immigration streams. They wouldn't gather enough points. And again, this is the challenge that we face where with our immigration streams and our point systems, we've sort of chosen to focus on particular groups of workers or workers with specific skills. We often do need general laborers. We also need skilled trades and scientists, but often we need general laborers. And for the most part, they can't get in through the immigration system. So often what happens is our companies will use the TFW program, not for temporary jobs, but to bring people into Canada and then try to find pathways to permanent residency for them. What we're asking for in our emergency foreign worker program is frankly no more than a Band-Aid. We really need to start to understand how do we structure our foreign worker programs so we are attracting and bringing people into the country who can settle here, who can bring their families with them, and who can really become Canadians and contribute to different Canadian communities.
Time for a short question, Madame Zerillo, if you have.
I think just one more witness to maybe answer.
Yeah, oui, merci. Juste pour ajouter.
Thank you. Our plants are oftentimes situated in rural areas. There's very little workforce, so we do planning ahead of time. Oftentimes there are plants where we have 300 workers missing, so it becomes extremely difficult, and sometimes the situation is critical. Some people retire, and so this is why the temporary foreign workers a lot of them, 87% would want to stay, and they come and they stay, and their families settle. And so this is very good for our regions as well, for them to become permanent residences, permanent citizens. So this is a project that we have, as Mr. Freyes was saying. This is an essential project so that our businesses can survive.
Merci, Madame Cirillo. Mr. Ruff, for 5 minutes.
Thanks, Chair. My thanks to the witnesses. I got questions for both food and beverages and housing. My first question to Ms. Sullivan is, my understanding from reading your documentation you provided, you first were asking for the Emergency Foreign Workers Program in late November to the ag ministers across both provincially and federally. I know when I met with the Exeldor Maple Leaf Foods, who both have processing plants in my riding, that initial ask was to have that program in place by 31 January. Have you received any indication from either Minister Bibeau or Minister Qualtrough of why that ask was not met by the end of January?
No, we've received no specific response to the question of why we didn't receive a response or our proposal wasn't implemented by the end of January. I suspect it comes down to sometimes the wheels of government departments move much more slowly than any of us would like. We certainly are still hopeful that there will be a response. To Dimitri's point, timing is of the essence. So much of processing is tied to agricultural production, and as I think most of you know, there is often seasons involved in that. And so the sooner we get a response and a program is implemented, clearly the better. January 31st would have been the best. For us, at this point, we will be happy to receive a response as soon as we can. I think critical as well is going to be the substance of that response, of course. Our proposal in particular is designed to reduce the burden on companies like Olymel, who are looking to bring temporary foreign workers into the country, but also we need to increase the number of people that are coming in. And critical for us is going to be if the federal government agrees to increase the cap that currently exists on food processing companies and that doesn't exist on primary agriculture. That cap has to go up if we're going to increase the number of people who are available to work in our sector.
Thanks, Ms. Sullivan. For the housing folks, I read your documentation here, and I'm going to go down this line of the inclusionary zoning that's within the documentation. And the issue is from a labor shortage perspective, especially in rural Canada, so many of the industries are having trouble finding workers because there's no place for those workers to live if they do get there. And so within the commentary there, you're talking about that if you make a percentage of the housing, market housing and affordable housing, that you got to sort of increase that. When I was talking to many of my developers and builders even last summer, because this was the biggest issue, the labor shortage that I heard throughout the election campaign, was that the fact is they're actually open to it, providing it's fair to everybody, all the developers, so that developer A is being treated exactly the same as developer B. But I'd just like you to expand a little bit on, how can what's the biggest challenges to building more affordable housing, and expand a little bit on your concerns, because you say caution's needed in these inclusionary zoning. Thank you.
Sure, happy to talk about that. In terms of inclusionary zoning in principle, the challenge is really just making sure that if you're going to allocate it and require a certain amount of housing to be affordable housing, and there are different levels of affordable housing, and a lot of times affordable housing actually refers not to housing people can afford, but social housing, right? Typically in the housing industry, that's what affordable housing is. So if you're going to say a certain percentage needs to be that affordable social housing, the real trick is to figure out how that's going to get paid for. And I'm here to tell you that when you say, well, the developers will pay for that, That's not how any business works, right? And so the way what ends up happening is that ends up being new home buyers who pay for it if there is not subsidies provided in some other way by government, either by providing land, providing breaks on development taxes, et cetera. So is it important to be that all developers in an area be treated the same with respect to inclusionary zoning? Yes, but it's also important that when you design inclusionary zoning, you're not inadvertently causing the price of market rate housing to go up, because let's say if 20% of the units are supposed to be affordable housing, if the other 80% is actually subsidizing the cost of the 20%, you just increase the cost of housing in your area. And it's also important, if there were going to be 100 units, and I say 20 need to be affordable, that's fine. But if 100 were going to be on the market and we have a huge supply issue, which is what's really driving a big part of what's driving up house prices, you got to make sure you're still going to build 100 units and that you should get 20 additional affordable units over and above that. So, those are sort of the concerns.
I think I'm out of time, Mr. Lee. Thanks. My final comment is, I know we've proposed a housing task force for across the country. I'm going to be likely hosting one of those in my neck of the woods. Looking forward to your association participating in that in the coming weeks. Thanks.
Perfect.
Now to Mr. Coteau for 5 minutes.
Thank you very much, Mr. Chair, and thank you so much to all of the witnesses today. All of the presentations were great. I was reading in Statistics Canada that employers were looking for 69,000 positions to fill in for construction work in the fourth quarter of 2021, and that number was just remarkable. I recently was walking down the street near my home, and a gentleman shouted out to me. He said, "Hey, you need a job?" I said, "No, I'm okay right now." But I said, "What job are you offering?" And it was a crew doing some work, construction work. So that's the first time that's ever happened where someone offered me a job just walking down the street. So you could tell that there's a need out there, and this impacts obviously people's residents. It's our economy. And it's a very serious issue. I know that in my city and right across the country, there's an unemployed. In Toronto, it's about 17.5% unemployment rate for youth. Across the country, I think the number is almost 14%. How do we tap into that next generation of potential construction workers? Because I'm assuming that the pay is quite good. There's a lot of work out there. It's highly skilled. What's the industry doing? And this question is to Kevin Lee and to Mr. Collins Williams. What are we doing to actually tap into that next generation of youth unemployed people?
Yeah, maybe I can start off and pass it on to Mike. But yeah, it's definitely something we've been very active in because it's critical that we get the next generation interested. We have quite a few initiatives in this area just to encourage and overcome different barriers and perceptions. I would say there's less of a problem with young people and more of a problem with parents and guidance counselors and sort of the system. It's been many years that we've been sort of directing people away from careers in the skilled trades and having the skilled trades a career of second, third, or last choice, as opposed to making it a first choice. Just because you do well in school doesn't mean that you wouldn't be a wonderful electrician, plumber, and probably a super successful one that ends up running their own business and has a great career and a great contributor to the economy. So we're doing quite a bit of work in that area to try and promote the benefits of the next generation. And maybe, Mike, I'll pass it to you to add on to that.
Yeah,
just to Kevin. And maybe, Mike, I can just kind of add a little bit to that. Maybe you can talk about this. And I think, I've talked to your association about these types of opportunities before for young people. How do we tap into marginalized youth in communities where those numbers are in the 25% unemployment rates? And I know that in I've seen the Carpenters and groups like the Hammerheads try to take on some of those challenges to attract marginalized youth into the construction work. Any ideas on what we can do as parliamentarians and also to support the industry as a whole?
I think to add to Kevin's comments, and it fits in exactly with your question, is we really do need to promote, and this comes onto the industry as well. We need to do a better job of promoting the opportunities for careers in construction. Not every kid was meant to go on to 7 years of school to become a doctor or a lawyer. There's tremendous opportunity, as Kevin said, in the construction field. It's an opportunity to work outdoors. It's an opportunity to work with your hands. It's an opportunity to really create something. And 10, 15 years later, to be able to go back through community and say, hey, I built that. It's also a very rewarding career. You can have people in their mid to late 20s literally making six figures. It's an opportunity to become an independent business person and build your own crew. I think something that we're trying to do as an industry is trying to get people at even younger ages. We're trying to get into high schools. We're trying to talk to the guidance counselors and the teachers about the opportunities, but also go to job fairs. And I think there's an opportunity to do more recruiting, just like universities and colleges go into high schools and do recruiting. I think our industry needs to play a role in that. And perhaps there's a role for governments through our education system as well to promote the diversity of job opportunities out there. There used to be shop at a lot of high schools. That started to disappear. People need to be well-rounded and learn a variety of skills, but, there's maybe kids in grade 9 and 10 that have no idea, what they can do with their hands and what skills they have to build and create things. And those marginalized communities, I think that's a path where you don't have to go to college or school. You can come right out of high school, get an apprentice, and instead of spending tens of thousands of dollars on tuition, you can be making money right away as an apprentice. So it's not only a pathway to a career, but there's not as many barriers at the start if you have the ability to earn money right away.
Right.
Note,
Thank you.
Mr. Coteau, we will close, and I want to thank the witnesses for appearing today before the committee with your informative testimony. Thank you so much. Merci beaucoup. Committee members, before we leave, as you're aware, I had reached out to a number of you concerning next Thursday, Budget Day, but since then I understand the whips have agreed, we'll be cancelling. Yep. Okay. Next Thursday's committee meeting, as I said, I consulted with the vice presidents and Madame Zerillo, and so we will not be meeting on next Thursday. With that, we will see you on Monday. Thank you so much again. Merci beaucoup. Tout le monde.